The swine flu virus killed 5 more New Mexicans last week. All were adults, all had other chronic medical conditions.
But today, state health officials announced a turn for the better. News 13's Maria Medina explains.
Diane, those officials say there is a significant drop in people coming down with the flu. More New Mexicans are practicing prevention, and state health officials monitoring the sick say this week
we are seeing a decline for the first time since this pandemic started.
The U.S. Department of Health and Human Services tracks the flu by regions. Compared to other areas, the region New Mexico is in has seen the most flu-like cases so far this year.
The southern tier of states in the United States were hit earlier.
But state epidemiologist C-Mac Sewell says the illness is now moving to the northern part of the country, and that's why the decline of swine flu in New Mexico.
Earlier in the month of October, we were seeing about a 30% increase in all our emergency rooms.
Deborah Hammer of Loveless Medical Center says in the last 2 days they've seen a big drop in urgent care patients. 2 other large metro area hospitals, UNM and Presbyterian, are reporting a drop in the past week. But Loveless says it's back to seeing a normal flow into its emergency rooms.
We average about 90 to 100 patients a day at Loveless Medical Center.
Still, Sewell says if history repeats itself, this lull is just a sign that another wave could be on its way.
From looking at past pandemics, that influenza can peak and then we can have a lull in activity and then we can have another peak later on. So I don't think we're out of the woods yet.
And even with the decrease, the amount of people with flu-like symptoms is still higher than normal. Sewell says even if you believe you've had the swine flu, you should get the vaccine just in case. Back to you.
Thanks, Maria. So far, 21 people have died from swine flu in New Mexico. Call your local public health office to check on the availability of the vaccine.